now we are going to be going to another story, very sad. Unfortunately, we do know that 48-year-old James Van Der Beek, he is the TV star that we all know from Dawson's Creek and a bunch of other things. Well, he died from colorectal cancer earlier today, it was announced. And so we want to know more about this cancer and how to prevent you, the viewers, from hopefully getting some treatment earlier on and detecting it early. So we have Dr. Shaleen Vasavada, who's a gastroenterologist at UT Houston, to give us some perspective. So thank you for being here.
Thank you for having me.
So one of the big things is, he's only 48 years old, but it seems like this type of cancer is really attacking a lot of younger people. And why is that?
So we don't really have a great reason why it's being higher. We're seeing a higher incidence in younger people. In fact, it is the #1 leading cause of cancer-related death in people under the age of 50. Some thoughts are a combination of lifestyle, genetic, and environmental factors that we currently live in America, including a sedentary lifestyle, not exercising enough, having a lot of processed foods, eating a lot of red meat, and not having enough fiber in our diet. These are some of the factors that people are affected by.
And what are some of the symptoms that you think people might overlook?
So symptoms that would be most concerning are any blood in your stool, a change in your stool habits or stool caliber, unintentional weight loss, and also persistent abdominal pain. Those are symptoms that you don't want to ignore and make sure to see someone.
Do you think getting the screening done at 40 is the right age that men should get it done, and women?
So currently the guidelines recommend to start screening at age 45.
And it's a story that sounds like a Hollywood.
If you have one of the symptoms that I mentioned, or you have a family risk, family history of colon cancer. But there are some thoughts that we should be screening earlier and earlier, especially in higher risk groups.
Do you think that there's any message that people really need to know when it comes to colon cancer? Because you see patients all the time. Is there a common denominator, some advice you could give people?
I think the best advice is to make sure to get screened. So we typically have 3 screening tests that we recommend. One is a colonoscopy and 2 are stool-based tests. Colonoscopy is actually the only screening test that not only can diagnose colon cancer but also prevent it. And we prevent it by removing polyps, which are small precancerous growths that occur in the colon. And so we can actually remove these during your colonoscopy and prevent cancer from ever happening.
All right. And I'm just going to ask this because I know a lot of people have this question. When you think of the screening, you're kind of scared and kind of like, what is happening here? I mean, how long does it take? What's the process like?
So the process starts actually the day before. You start prepping, so meaning you're taking laxative in order to clear out your stool and make sure we get good visualization on the day of. And then when you come for your colonoscopy, typically you will be put under anesthesia, and most of them last anywhere from 20 to 30 minutes. And then after that, we can give you some results, and you can go on your way home.
Yeah, it takes the morning maybe, and then you just go on your merry way. All right, well, I appreciate that, and I hope that really convinces a lot of people to go out and get screened. Thank you so much.
Thank you.
All right.